Uh, okay, thank you everybody. My name is Henry. Orthopedic surgeon at the Mount E Hospital. Today we are talking about why does the knees hurt. I suppose now during the circuit breaker period, a lot of people maybe bring out the weekend warriors from us, and maybe now we're doing a bit of exercise, and then you find out that why suddenly my knee is hurting. And of course, also to during this period when everybody is very bored, we hope that we make the most out of this period, keep ourselves safe and keep ourselves healthy, and that's why we may also want to learn why suddenly your knees hurts. Can everybody hear me? Keith, is it clear?
Yep, loud and clear.
Okay, good. Okay, then we start. Okay, so a little bit about myself. Okay, I'm a local graduate. I did all my training in Singapore. I'm also privileged to actually go to the Germany for my fellowship. Fortunately, not in this year. I went over in 2014 when they actually won the World Cup. And fortunately, they won the World Cup. Also, I had a pretty good time there. Okay, so at this small center in Hamburg, in fact, they actually do 5,000 knee replacement in a year. So it's actually the largest center in Europe. So it's pretty impressive, the setup. Okay, this is our webpage, and of course, if any of you are interested, you can always go up and take a look of our content. Okay, it's at www.hcauto.sg. Okay, so we offered a comprehensive treatment for most of our patients. So if you have osteoarthritis, sports injury, or fracture or slip disc, we are more than happy to help you along. Okay, so let's come back to today's topic. So why does my knee hurts? Okay, in fact, I will say that in summary, there's only three major causes of knee pain. So number one, of course, the most common is of course injury, especially in the younger generation, the sportsmen. Of course, then maybe when you are more than 50 years old, then arthritis sometimes can kick in. And finally, if let's say suddenly out of the blue moon, you suddenly realize, hey, well, my knee hurts like hell. And then sometimes you might be wondering whether it could be a uric acid problem causing gut affecting the knee joint. Okay, we'll go through a little bit more in details. Okay, so injuries. Okay, this is a brief overview of the knee anatomy. Okay, so any of the structures can be damaged in injury. Okay, it could be a ligament tear, ligament rupture, meniscus tear, or sometimes even direct injury. Sometimes can cause cartilage damage, and of course, you can even have the bone can even crack during a bad accident. And of course, all this will give you bad knee pain. Okay, in terms of ligament tear, I would say that the anterior cruciate ligament, or in short form ACL, is the most commonly torn ligament. Um, Most of the time it's due to a bit of a twisting injury during the sports, especially in soccer, basketball, or skiing. And usually the patient will all tell you that, oh, I heard a loud pop sound in my knee joint. And then suddenly you realize the whole knee is swollen up and it's so painful that most of the patient cannot even walk straight away. So what happens is that the ACL itself is a very important ligament to hold our knee stable. Okay, so when the ligament is ruptured, the patient will always tell you that, hey, my knee feels very loose. It feels like disconnected. It's like it's like my car can only go straight. I cannot turn. That's why I put up this picture. Now your leg your car can only go straight. You cannot turn. Once you turn, you feel that hey, the body turn, but the leg doesn't follow. And then every time you do that, the knee buckle and then you fall down again, and then you damage more structures in the knee joint, causing a worsening injury. Okay, this is how the MRI looks like. Okay, so this is the we call it the lateral view. We are looking at the knee from the side view. Okay, nice. You can see in this picture, you can see the computer arrow. There is a nice anterior cruciate ligament here, nice and thick. But of course, if you look at the one on the, what did I do? Okay, if you look at the one on the right hand side, you can see that the ACL is completely gone, no more ligament there. So in that aspect, this patient suffers from a complete ACL rupture. Okay, so usually in the initial phase, of course, if the patient tells me that, oh, I'm actually a couch potato, it's just that out in the blue moon, I actually went for exercise and I usually don't do any exercise at all. Okay, then fair enough. Sometimes we may have to consider a non-surgical treatment. Of course, in the initial phase, when the knee is all swollen and painful, of course, we have to do a bit of initial treatment first. A lot of the time, we actually, some patients may even need to withdraw some water out from the knee joint. And then we will actually ice it, anti-inflammation, and also we will get the physiotherapy. For the patient, typically, you have to do at least about 1 month to 6 weeks of rest before your knee is actually ready to exercise again and go on to the second stage of treatment. And in the interim period, I will actually recommend the patient to go for some kind of a bracing to protect the knee. As I have mentioned before, once your ligament is torn and your knee feels very loose, you can actually get injured again very easily if you're not careful. So without the brace, before you can even go for the second phase of treatment, you may get injured again and then you delay the whole treatment process again. So I'll usually recommend them to wear a brace. It protects you in the initial period, and also the brace can be used for the second phase. After your surgery, it can be useful as well. As I mentioned just now, if let's say you are really a couch potato, you really don't need to do any kind of exercise, fair enough, you may not even need to have surgery done. But for most patients, if you are active, you still want to go back to sports, I would say that ACL reconstruction is the only option, because the problem is that the ligament doesn't heal by itself. And every time, it's like just not the picture, if you don't do it, your car is out of control. Okay, so this is one of my personal favorite brace. I must say that Ortho brace is very good quality and lightweight, and it's not too bulky, and it's not too stuffy. So actually, it's still reasonable to use in Singapore, where those were very enclosing kind. Sometimes very hot. Before the patient can do anything, the rashes broke up already. So that's also none the wiser. Okay, so for ACL reconstruction, actually we use a minimally invasive techniques. We can use all done by keyhole, and in fact it's only require a day surgery, or sometimes most patients within a 1 night stay. We aim to return to sport in 3 to 6 months time. And in fact, if any of the audience are soccer players, all these players actually have the ACL reconstruction done before. So Ibrahimovic, Van Nistelrooy, Totti, and last time the Ronaldo. Now of course it's another one, but this is the original Ronaldo. And for basketball player, Derrick Rose, and actually we are still waiting for Klay Thompson to come back to play. So he just had his surgery done, and now he's going for the rehabilitation process. We'll see how well he played after the ACL reconstruction. Right? So anyway, the point of it is that ACL reconstruction or ACL tear is not the end of the world. You can see these professional players with the surgery, they can even go back to play. Okay, so I will show you a bit of this video to show you how unstable the knee is after the ligament reconstruction. So this patient is quite big size. You can see that his knee is really bad. I didn't need to use too much exercise. Movement, you can see his knee is moving left and right, and you can see this patient is quite big size. You can imagine walking around with this kind of a knee. It's just a matter of time he get another injury, or even and then more damage is done to his knee. So this is after his surgery. So now you can see that the same movement. Now the knee is stable. At least she can walk stably, and that allow him to do his exercise, and hopefully in the end of the day, I will recommend him to lose a little bit of weight. But you see, the bottom line is that if your knee is like that, so unstable, no way that you can do exercise, and you just put on more weight, and at the end of the day, your knee is get even worse in your knee problem. So meniscus tear is another big problem in terms of causing knee pain. So meniscus is, if you remember just now, that the meniscus is in between the knee joint. Let me show you. Okay, so this is the knee model. Okay, so this is the thigh bone. this is the leg bone, and in between, actually the you can see this is the cartilage, and this is the meniscus. Okay, so the meniscus usually it forms of stabilize the knee joint, and actually it can also distribute the load to the knee joint. So the most common injury pattern is due to sports injuries. The patient get tackled, or he had a very bad fall. Sometimes the ligament tear and meniscus tear can occur at the same time, or sometimes can be separated. But also another large group of it is what called degenerative tear. So some patients tell me that the injury can be very minor, very trivial. They are actually maybe go up to the bars at the wrong angle, or they come down the bars at the wrong time, or they're rushing to cross the zebra crossing. And sometimes this kind of incident can also cause a meniscus tear in a more elderly generation. Then a lot of them will complain of pain, and they can also notice swelling, and sometimes this meniscus can be flipped into the joint and then causing what we call a locking. They can feel that the knee joint is suddenly jammed, only at then suddenly somehow they shake it or what, then the knee can move again. So these are the symptoms of a meniscus tear. So I want you all to remember this is how a healthy meniscus looks like. Looks very nice. Okay, the cartilage on top is in the thigh bone, in the femur, it's all smooth. The meniscus in the cartilage in the tibia, the leg bone, is also very smooth, and then in between the meniscus is all nice and smooth. Okay. So this is how meniscus surgery looks like. Okay, so in this patient, you can see that this thing that is moving in the screen is actually the meniscus tear. By right, yeah, you can see now that there's this meniscus used to be one piece, and now it became a huge crack in between. And just now the whole meniscus, you can see that it's actually coming into the joint, like here. Let me show you again. So this movement are not supposed to be there. This piece are not supposed to even move into the center. Now it's because it's a huge crack that the whole piece is coming out into the joint, and because when it's jammed inside the knee joint, can you imagine now suddenly when it moves into the joint and then you start walking, you feel that the knee is jammed and locked. So this is how it looks like. Okay, so after cleaning up, you can still see that there is a big crack there. Okay, but this is actually then we can put stitches inside the knee joint, inside the meniscus there to stabilize it. Okay, so all this can be done under keyhole. We only need to make about 1 cm cut on each side of the knee joint. 1 cm cut here, 1 cm cut here, and it can be done. So no longer the very major surgery. In fact, one of the most commonly done orthopedic surgery in the world. Okay, so again, I want to show you all a nice cartilage. Just now you have seen one also. Okay, so cartilage can be also damaged by injury. Okay, so by right, this cartilage is smooth and resilient. It's very elastic and bouncy, and in fact, it allows us to run around, jump around, to do all the extreme sports without any pain. But because, but at the same time, because it's the knee joint is taking so much pressure, if you're not careful, any injury can in fact damage the cartilage as well. So most of the time, it could be a direct injury. You can be like directly fall down on the kneecap, and you suddenly, wow, the whole knee is swollen up. Or sometimes you can be a repeated kind of injury, especially sometimes when the patient has a lot of clicking sound. It happens in a young time, in a younger patient as well. Sometimes in teenager, they realize that, how come my knee got a lot of sound? Like when I move, I feel a lot of clicky inside the knee. And as time goes by, another 10 more years, 20 more years goes by, all this friction, abnormal kind of friction, can become pain. And you can imagine this kind of rubbing and friction. After 10, 20 years, it can cause a very bad cartilage damage. So again, just now if you remember, a nice cartilage is all nice and shiny, and you can see that this patient have a big hole, a big ulcer in the kneecap there. Okay, so this is so what we do is that we actually do a bit of work on microfracture technique. Okay, this is actually to extract the bone marrow out from the bone itself, the thigh bone. Hopefully, the cartilage can regrow from our stem cells. Okay, to make it better, now you can see that the same patient. Now the next step is that after drilling all these small holes into the bone marrow, the marrow cells, the stem cells are slowly coming out. And now actually we have a better techniques these days that we actually can implant some, call it empty cartilage cells. Okay, so hopefully, as I build the houses for the cartilage cell, for the stem cells, and all they need to do is to stay inside, and then they proliferate, and hopefully they can repair back the original lobang and prevent further friction in the knee joint. And by reducing the friction, you restore the function of the knee and also reduce the pain and swelling. Okay, so just now what we mentioned is injuries. So ligament, meniscus, cartilage, and the bone, they can be, all the injury can happen together, or they can happen separately. Okay, but arthritis is actually a little bit more. So basically, it's like, oh, the whole place is so damaged already. It's like this car tire is damaged beyond repair. So then we have consider what we call replacement. Okay, so arthritis basically means joint inflammation. So arthro stands for joint, and itis stands for inflammation. When you combine the two together, it actually means joint inflammation. The most common cause of joint inflammation is osteoarthritis. So it's considered the basic, the normal wear and tear. Okay, and of course the other big group is what we call the autoimmune disease. Rheumatoid arthritis will be the most common cause of autoimmune arthritis, and these are the patients that are very unfortunate. Their body mistaken their joints as their own enemy, so their immune system are fighting their own joints. It typically happens in the hands. It can also happen in the knee joint. Okay, so again, the nice cartilage, just want you to remember. So nice and smooth on top, nice and smooth below. And the next one is actually how it looks like in bad arthritis patient. You can see that all these are the bare bones, the no more cartilage left, and the whole place is basically completely worn out. Not possible to consider repair anymore. Okay, so these are some of the X-ray findings. Okay, you can see that in between the bone, they used to have a nice joint space. In this patient, this joint space is completely narrow. In fact, the bone is rubbing on bone. And if you look at it carefully, you draw a straight line there, you can see that this leg is no longer straight. Then you can see that in a lot of the, last time when you go to the market or into the supermarket even, or just walk down the road, you can see that a lot of patients are walking like a cowboy. They don't choose to walk like a cowboy, but because of the disease, the leg is so bowed that they're walking like that. Okay, so and osteophytes is also part of the disease. You can see that all these are the early stage, when the bone spurs are actually forming. And in this patient, the friction is so much. In fact, this patient had a bit of what we call loose body. The cartilage until there's a big piece of bone actually form in the knee joint. So how do we prevent treatment? Okay, most importantly, I would say that the body weight is we have been proven that is the most important cause of early arthritis. I myself are guilty of that, so I also need to lose some weight. But of course, sometimes in some patients really beyond the stage of prevention, they already, I always call it a chicken and egg. They are a little bit big size, and then because of that, the knee joint is really worn out, and they are walking in so much pain. And for them, even if they want to lose weight now, it's not possible because of the severe pain. So we need to break the cycle. Of course, if you are still early and there's a little bit the knee pain just starting, of course, we can try to optimize further. We can do some physio, we can avoid carrying heavy load, we can also avoid the stairs and the squatting. And also bracing will be helpful. So when, let's say, the patient come in very early, I will of course suggest to do some simple stuff first. We can always try a bit of anti-inflammation. There are many cartilage supplement in the market. We still use a little bit, but honestly speaking, the effect has not been very good. In some patients, it helps a little bit, but in most patients, it doesn't. It only provide a little bit of symptoms relief, but in the end, it doesn't really reverse the problem. And of course, some patients also, if let's say they come in quite early when the arthritis is still very mild, we can actually consider a bit of injection in terms of the lubrication injection. It can actually help them. And of course, braces, walking aids. And if let's say everything else has failed, or when the patient leg is really bowed, typically no other treatment is useful, then you may want to consider surgery. Okay, so again, this brace from Ossa is quite useful. If you have quite mild arthritis, you can actually consider this offloading brace. They actually literally shift the weight a little bit for you. So in patients who are still relatively mild in their disease, they can still wear this brace and can even go and play sports. Of course, not a very high impact sport, but no harm if you can still enjoy 18 holes in the golf games. Okay, so these are some medication. I'm sure some of you have seen it. So the cartilage supplement, I will say that really it helps a little bit. Some patients find it useful, then I think it's fair enough. Bottom line is that there's no major side effects. So if the patient do feel that the cartilage supplement is helping me in whatever way it is, then fair enough. And of course, we can also give a bit of anti-inflammation medication like Panadol, Tramadol, and also NSAIDs and COX-2 inhibitor like Acoxia and Celebrex. But bearing in mind that all these strong painkillers are rather strong, sometimes they cause side effects in terms of gastric upset. They can also damage the kidney. They can cause a bit of fluid retention, drive up your blood pressure and things like that. So once in a while, you tell me I only need to take a painkiller like maybe once every week, or only when I go for tour, then I take a little bit of painkiller, then I think it's fair enough. But of course, if some patients are so painful that they have to take painkiller every day before they can even go out to do marketing and go to buy groceries, then I will seriously suggest the patient to consider some form of a long-term treatment, because in the end, if your kidney is damaged, your stomach got a hole because of bleeding from all the strong painkiller, then it's not worth it. Okay, so intra-articular injection. So you must have heard a lot of this injection. Actually, sometimes a lot of I myself still do. I myself give also, but it has to be in the correct indication. So if let's say the patient is very mild, I do suggest that a bit of injection lubricate the knee joint. It can help. Okay, but of course, if the patient has really very bad stage, the whole cartilage is all gone, then typically this injection doesn't really help. It does not reverse the pathology. Usually, I myself don't like to give too much steroids injection. Steroid injection, no doubt it's very useful, but sometimes it causes long-term side effects, especially if you give it repeatedly. So of course, if some patient that has a one-time sudden onset of knee pain, I think it's fair enough to consider a single injection. But of course, if you give it repeatedly every month, you say I have to go back for injection again and again, then I say that it's not the correct treatment for you. Okay, so some patients even consider a minor keyhole surgery to try to clean up the joint. It can help, but in the end of the day, I must say it doesn't reverse the pathology, and it only give you maybe short-term relief. So if let's say the patient is really maybe in the early 50s and they really say that I don't want to consider knee replacement surgery, sometimes we can consider a bit of this cleanup surgery. We can also try to repair whatever it is, but sometimes the degree of damage is too much that repair alone is not enough. And typically the patient will have to come back maybe after 2-3 years, then they have to consider another surgery. So usually we have to explain to the patient clearly what they are looking for. Okay, so if let's say I always tell my patient knee replacement surgery is like changing a car tire. Okay, if your body is still very good, you are still, let's say, working, you have very sharp mind, just like your car, your engine, your car, everything is still in very good condition. You wouldn't want to say, oh, I want to scrap the car just because of punctured tire. Okay, so we can easily change the tire, and then you can get another new leash of life. Okay, so sometimes if the arthritis is the patient didn't come too late when the deformity is not so bad, sometimes we can actually consider what called partial knee replacement. It is a smaller surgery and faster recovery. But of course, in some patients, it's not meant for all patients. If the patient, the knee joint is really completely damaged, then sometimes they have to consider a knee replacement. Or sometimes when the arthritis is so severe, they affected the cartilage, they affected the ligaments, then usually this kind of partial knee or half knee replacement is not possible anymore. Then they have to consider total knee replacement. Okay, so I will say that the only solution, the only cure for arthritis is actually total knee replacement. So it can replace the damaged cartilage, so that the rough part doesn't have the it's not rubbing and causing pain anymore. You can realign the limb, so the leg is no longer crooked. So the leg is no longer crooked, it will be straightened up, and of course it restores the quality of life. And now with a better material, we can hope to achieve 15 to 20 years of results on the knee replacement. Okay, this is how it looks like. Okay, so we have the new ones, real ones for you here. Okay, so this is the thigh bone. It's actually to put it onto the kneecap there. Let me show you better ones. So sorry. Okay, so this is how it looks like. Okay, so the knee replacement, in fact, it's just like I'll say a dental surgery. We put a cap onto the thigh bone. All the damaged tissue are all smoothed out, and then we put it onto the leg bone. And most importantly, the kneecap is no longer crooked and it's actually straightened. This is a bit of a case example. So again, on the left hand side, you can see this patient is very big size, and you have a severe arthritis on the inner side. And we did a knee replacement surgery, and now you can see that the leg is straightened. Same thing, this patient, very bad arthritis on the inner aspect of the knee joint, and you can see that the outer joint has already been affected. So for the patient, we also did a total knee replacement for her, and then you can see that the knee is restored. This patient even more severe. You can see that the arthritis is so severe that in fact the bone crack off. We can still do something to help the patient, but of course you can see that we have to use a bigger implant for the patient. So I must say the patient really the suffering is quite offended. The patient had to really endure the pain, and the surgical time is a bit longer, and also the cost is more because of the bigger implant utilized. So this is what we want to do. We want to make sure that the knee joint, the whole leg is straightened again, not in a bowed position anymore. Okay, so this is a patient of mine. Okay, you can see that he's now they focus on his left knee. So his is one of the very bad arthritis. You look at the left knee, you can see that his knee is buckling. Every step he walks, his left knee buckles because the leg is so bent that it lost the original support. Okay, the left knee again, you can see that it's really buckling. Every step you walk is painful. Yeah, so this is beyond what I call keyhole surgery and beyond the glucosamine that can help him. So we did sorry, let's not bore you. Okay, so this is how he looks like. Okay, believe it or not, he's the same patient.
Wow, so handsome. Okay, you turn around.
He's very happy. In fact, it's only about maybe 1 month down the road, and he is very happy about his result. Even his his children, his young children say, "Appa, you are working so much better now." Okay, and I'm happy that I help him. Okay, so again, this patient also had, in fact, bilateral knee surgery, one after another. You can see that she actually walks very well. Let me play the video.
Turn around. Can walk.
If she doesn't pull up the leg for you, you wouldn't realize that. If she doesn't wear a short trousers for you, you didn't realize that she has actually both her knee joint replaced. If I walk behind her, I wouldn't realize her as well. Okay, so we're walking very naturally. Okay, and in fact, some patients, if they really train hard, they can even do a
Can you squat for me? Very good.
Yeah, this patient is 78 years old, believe it or not. Yeah, so he
can
keep
you squat
himself
for me?
very strong. He keep himself very
Very
fit.
good.
I think he's fitter than me. Okay, so I will say that now the total knee replacement has been like maybe the second, third generation already. It's not the same anymore. Like last time, maybe 20 years ago, your doctor will tell you that the success rate may be 50-50. 50% you can walk, 50% cannot walk. But now it's not the same anymore. I would say that if it's done under expert hands, 99% success rate. Okay, why we can achieve such good results? Because now we have better technique. We are now talking about precision and accuracy, and we have better material in respect of ceramic implants, and now we have a better pain management also. So gone are the days that the patient are so much in pain that they have to use so much morphine that they cannot even walk the next day. Okay, so better technique, computer navigation now is in everywhere. Even your kid nowadays may be playing this Switch and the Wii last time, and of course I'm confident that I can do better than them. Okay, so in fact it's everywhere, and now robotic surgery is also kicking off. So we hope that this one will bring us the next wave of revolution for knee replacement surgery. Okay, so computer navigation. So basically now your alignment, your anatomy can be fed back to the computer. So now it's almost using your own eye versus the entire computer suite on the robots and see which one is more accurate. So I might be accurate 9 out of 10 times, but I'm confident that my computer is accurate 10 out of 10 times. So no matter what, I don't think I can beat the computer in terms of accuracy. Okay, so in fact, in this patient, you can see that her leg is so bent. In fact, she has very bad arthritis, and at the same time, she fractured her leg. So it makes it even worse. So you can see this patient had really maybe a 45 degree of curvature in the leg. So after the surgery, in fact, we can actually correct it back to almost 1 degree. And you can see that the alignment is very straightened. The patient is very happy. The bone crack has also been fixed as well. And this is the alignment of the patient. You can see that the leg is all in straight line again. And nowadays we can even do 3D printing. In fact, I can do almost half the surgery in my computer screen. Okay, so with the patient-specific instrumentation, we can actually manufacture computer the alignment jigs out of the computer, and this jigs only fits onto your bone and nowhere else. And we can in fact plan how big, how small, how does it fit, all in the computer. So we can actually reduce the time in the operating room and reduce the uncertainty, and we don't want to fumble during the surgery, say, oh, whether this is one side up, one side down, and everything will be done at the comfort of the patient, and also improve the accuracy and safety and reduce the surgical time of the surgery. So this is how it looks like. Okay, so this is all 3D printed, and it only fits onto a particular patient. So even if you get robbed by another person, you cannot steal away your computer jigs. It doesn't fit for them. Okay, so robotic surgery. Okay, so now we are using the best robot right now. It's called Macroplasty. Okay, it's not as cute as this one though, unfortunately. But this is how it looks like. Okay, basically, it uses a computerized burr, and this one will have all the information of your anatomy of your bone structures, and they will make sure that the alignment is done properly, and you cannot even go out of the position. And this one is also another additional benefits for the patient. That's how it looks like. Okay, it's a huge machine. One day we might be able to have a handheld machine, but this is the first generation. I'm sure it will get better next time. Okay, and also at the same time, okay, maybe I should play the video for you. Okay, so this is how macroplasty looks like. So you can see that this surgical arm can actually go to almost 360 movement. And now basically we can do this half knee replacement surgery with great confidence. Because last time what happened is that the older technique sometimes may not be able to be seen so clearly because of the smaller cuts. So precision has always been a problem. So with the robotic techniques, it actually takes up the guesswork out of the equation, and then every patient we can be very confident that the position, the alignment is optimal. And in fact, nowadays we can even put two together. So I will say that consistency is the word. Okay, so in this patient, only one-sided arthritis. When a particular only one part of the knee joint is damaged, then fair enough, we can consider only single compartment or half knee replacement. But of course, in some patients when the knee is too damaged, then we may have no choice. So this is how it looks like. It really looks like playing computer game. Okay, basically we can be 100% sure. The accuracy is up to 1 millimeter. So this computer burr will actually, it's all computerized. The computer will stop if you actually try to, or someone try to sabo you, try to bring the burr to the other side, it will stop automatically. Once you're out of the position, it will stop. So we can be 100% sure about accuracy and safety. Okay, so just now we mentioned that these are the newer techniques: computer navigation, 3D printing, as well as a robotic technique. At the same time, we also have better material. So this is a material that I always use. It's called oxinium. So if you can put it side by side, you can actually see a lot of difference. Okay, so other than now you can't feel, but the older material is actually a lot heavier. Okay, so this ceramic implant is actually better in the sense that it's lighter. Okay, so it's a mixture between ceramic and metal. So in a sense, it has the best of both worlds. It's smoother, at the same time it doesn't break. So it's almost like you can hear, it's like almost metal as compared to a glass kind of ceramic. Okay, so it's longer lasting. Hopefully we can stretch the lifespan of the implant from 10 to 15 years to 15-20 years. And also at the same time, because it's ceramic, in general, there's lesser chance of metal allergy in a patient who has metal allergy problem. Okay, so again, also better pain management. Now a lot of patients are actually quite happy. Most of my patients, maybe over 95%, they walk the next day. So this is one of my patients' journey. Maybe I'll share with you all.
Hi, I'm boxing. I used to run for long distance, 10 kilometers, and over a period of time, my knee started to problem, my right knee, and I feel pain, and I cannot stand straight. What to do? Quality of life is affected. So I went to consult Dr. Chan. But how do I come to know Dr. Chan? Because I know him from friends on Facebook. And Dr. Chan examined me and told me that, yeah, I need to do something about the knee. And that something is a total knee replacement because the ligament and the cartilage inside is badly being worn out. If I don't do it in time to come, my quality of life is affected. I'm not able to walk straight, and a lot of things I can't. Now, then I went for an operation. Now, the operation took about 1.5 hours, very short. And after the op, well, the X-ray shows that everything was fine inside, everything was perfect. And immediately the next day, I'm able to stand and walk just a head and a frame, walking stick, and walk on my own. And it's fine when I stay in the hospital for about four nights, 5 days, and on the 5th day, before I discharge, I'm able to stand straight on my own. I'm able to sit on the chair and rise out. Progressively, over the last 1 or 2 weeks later, I'm able to squat, I'm able to cycle stationary, I'm able to walk freely around. My advice to all of you here is this, that those of you who have a knee problem, do not wait. You need to consult. I need to go and find out what's wrong with it. And consult a specialist, and the person like Dr. Chan, who's so well versed in this, he'll be the advice you what to do. Then you get it fixed, get it done. Then the quality of life will improve. You delay, you'll become a problem, right? So for myself, I'm very happy with what I am, and with the skill of Dr. Chan, I think I'm good shape to come.
Yeah, so yeah, no longer the very bad experience. Some patient last used to tell me, wow, the pain is so bad. The pain is so bad, it looks like being bitten by a vampire. But I would say that nowadays the pain management has been much better. A lot of patients are quite happy, and you can see that before. Even when right after the surgery, he's quite happy with the thumbs up sign. Okay, so I will feel that now the goalposts have been changed. So now no longer, I would actually like to challenge anyone that has a mobile phone. The last time we call it the water bottle on the left hand side. If you still have it, I give my you can. I can give you a free surgery if you still have the left water bottle on the left hand side. Okay, but I would say that the goalposts have changed. Now that everybody using the smart device, and why do we want to limit medical to the old technology? So you cannot say that, oh, it's been working well for the last 20 years, it should work well for the next 20 years. So why need to invent a better technique? Why do we need to progress? We can just use our old grandfather's techniques. I feel that absolutely, I think the goalposts have changed, and I think that the old style of doing things, we could be good, but now we could do it better with technology. Yeah, so okay, finally we come to the end of the talk. Okay, so uric acid is another big problem, especially nowadays. Okay, so the actual name is called gout. Okay, so usually I tell my patient that it is rich man disease. Okay, why I say that later I'll tell you. Okay, so uric acid, they literally the one on the right hand side, these crystals are real. Okay, if you eat a lot of this high purine diet, in fact the saturation go too high, all these crystals actually come out in the joint, and you can see that it's so painful. Can you imagine walking with pins and needles in your joint itself? It's going to cause a lot of pain and swelling. Okay, so it's mainly diet related. I must say that 50 years ago, when we don't even have enough food to eat, nobody have this problem. But now, when we become more affluent, we like to eat all the good stuff, and now things get more and more patients are actually being affected by gout. Affects the men more than the female, or maybe it's also because of the diet. It always tends to happen in the big toe. Okay, then the second most commonly is in the knee, and finally it's in the ankle joint. Okay, and in the very severe cases, you can even form this kind of what we call tophi. It looks like a white chalky material. So this is a white chalky material. Some patients with very severe gout, they can even the uric acid can actually become one whole lump in the hands, in the elbow, and in the feet. So of course, treatment, prevention is always the best. Okay, as I mentioned, it's a Richmond disease. If you don't eat all the whole liao, then you won't have so much of these attacks anymore. Finally, of course, if let's say some patient tell me, hey, Dr. Chan, I already eating nothing, eating grass, and yet my gout tend to flare up, then sometimes we have no choice but to start some patient on a long-term treatment like allopurinol. Colchicine is meant for quick relief and the patient just have an urgent early attack. And sometimes we can use colchicine to resolve the attack. And finally, if let's say the gout has complete damage to joint or is and just now the patient is really coming out from the skin, then we have no choice but to do surgery. So basically, this is a list of food that will cause a gout attack. Okay, so on the left-hand column, these are the food that is safe. Okay, in the middle, this food should be consumed in moderation. Okay, but on the right-hand side, it's also my personal favorite, all the whole liao in Singapore diet. Scallop, siham, sotong, ducks, all the organs, innards, like maybe the pig organ soup, bak kut teh, or all the very tasty Cantonese soup that they are double boiled so many hours. It contains a very high amount of uric acid and purine inside. Okay, so alcohol, beer, whiskey, and wine also contain a lot of purine, and actually vegetables also. So if you are someone that like to eat a lot of kacang, or some even vegetarian that eat a lot of beans, then they can actually prone to attacks as well. And not to forget, fruits also. During our national fruits can also cause a lot of, it contains a lot of purine and it may trigger a gout attack as well. So, so these are the things that you may want to look out for. Okay, finally, let's conclude the end of my talk. Keith, is there any question from the audience?
Yes, there's actually a lot of questions. So we still have a bit of time until 3 p.m. So we'll try to go through as much question as possible. Otherwise,
Sure.
you can either email us or drop by our Facebook page to look out at the answer that will be answered today. So Dr. Henry, the first question would be, what happens after 15 to 20 years if I do a knee replacement?
Okay, so this 15 to 20 years is actually a very conservative estimation. So I must say that taking care of your knee joint is like taking care of your car. So some people after 15 to 20 years, the joint is still working perfectly. In fact, we have some patients that have been having a knee replacement for up to 30 years. So if the patient has no pain, no symptoms, then they're absolutely happy. That no need to, it's not like a time bomb that it will snap after 15 to 20 years. But if let's say, unfortunately, if let's say the knee replacement really had reached the end of the lifespan, we can actually change it. In fact, the reason why I go to Germany is to learn all the special techniques to learn how to do the revision surgery. So because they are the Angmos, the overseas, they're actually a little bit ahead of us in the sense that they have been doing knee replacement a lot more than us. So that's why I go there to learn how to tackle all these problems. So even if let's say finally after 15 to 20 years, unfortunately the knee joint has reached the end of the expectation, we can still change it for you, no problem at all. Of course, if you take good care, no pain, no swelling, you're absolutely happy, no need to change.
Okay, so the next question, right, is on the first case study that you shared where the patient has severe left knee TKR. So post TKR, the alignment looked good, but how will you describe his gait and suggestion to work on it?
Okay, of course, a lot of patients after that, because usually the knee pain doesn't happen within one day. Typically, they have been dragging for 6 months, 1 year. Sometimes they even learn the wrong gait. They will feel that the wrong gait has been normal gait. So sometimes after the surgery, we need to train them up a lot. And what happened also at the same time, because of the pain, they couldn't really exert on the leg. They lost a lot of muscle. So these are the things that the therapists will come in to teach them how to use their knee, walk straight, walk properly, and also to re-strengthen the muscle. So most patients, in fact, they walk very normally. Sometimes even if they wear a long pants and they come into the clinic, I wouldn't realize that they actually have knee replacement done. So the whole purpose of knee replacement surgery is to restore their mechanics and also their quality of life.
Okay, so this next question, right, there's multiple questions inside this question. So okay, so the patient was saying, "Hi, Dr. Henry, thank you for sharing. I would like to clarify for ACL injury. First thing is, how do we know a must to do ACL reconstruction? And then the second thing, can bracing help in the healing of ACL? And if there's any severity pointed to ACL reconstruction?" And then should I continue, or do you want to cover the first half of the
severity, is it?
Yeah.
Okay, so usually the ACL, as I mentioned, the problem of ACL is that it doesn't heal by itself. So if you clinically you feel that it's unstable, and then we can also do if in the clinic and we can test the knee. So if I can do the same maneuver that your knee is really moving like just now, then usually I would suggest reconstruction surgery, because as I mentioned, even you wait for 5 years, 10 years, the ligament won't heal by itself. Of course, if you feel that I'm not a very active person, I just want to enjoy a little bit of stroll, I don't mind wearing a knee guard at the same time, then fair enough, then you may not need to do a surgery straight away. But the patient must be compliant. They must have the knee brace, because the knee is always rocking. So imagine if you forget to wear the knee brace and you repeatedly twisting the knee and giving way, it will damage your knee much further. Okay, so the severity, in fact, most problem is that the ligament itself, once it's stretched, it's a bit like a rubber band. So some patients feel that on the MRI scan we can still see one piece of tissue there, but sometimes the ligament, once it lost its tension, there's no more usage. So although physically it's still one piece, you still have one piece of rubber band there, but once it lost its tension, it doesn't serve the purpose. So if the knee is still moving, it's still rocking, then this ACL is torn. So of course, concomitantly, some patients even have meniscus tear, cartilage damage during the same injury. Then these are the patients that I would strongly advise for surgery.
Okay. Maybe we'll go for one last question.
Sure.
So okay, this person, I have done the ACL reconstruction, meniscus and cartilage repair on my left knee.
Wow.
Lately, my knee will get a burning sensation pain. I have issue walking. However, the pain will suddenly go off in a couple of days. Could it be caused by inflammation due to new injury?
Okay, so I will suggest to do a quick check. We can do a quick maybe blood test to confirm. If this pain suddenly comes and go, then he might be having a gout problem. It can often concomitant with whatever problem that he has. And also we want to find out what's the causes of this kind of sudden pain. You see, after exercise, then he has the pain, then it may mean that his rehabilitation may not be done properly, or if you tell me that every time I go for bak kut teh, now it's bak kut teh is the very famous topic now. Okay, so if you go for bak kut teh, then suddenly come back, the pain comes, then we stop for a few days, then the pain goes, and he might be having gout at the same time. We can do a quick blood test to actually find out.
Okay, sure. So for those questions that is after Jean, right? We are sorry we don't have the time to carry on with all these questions, but do not be afraid. We will take down your questions and we will post the question, the Q&A on our Facebook page, or if you want us to email you the answers, do email us at our enquiries@osr.com. and we will send them to you within the next week. So we still have 5 minutes to 3 o'clock. So we will still be here. If you still have any question, feel free to post it out on the chat and it will just take in all the questions until 3 p.m. If not, then I want to thank Dr. Henry for your time today. And I want to thank everybody that joined this call and hope you all have a great day ahead and stay safe during this circuit breaker period.
Yeah, thank you everybody. Really, if we can do put our hands together for the author team. Yeah, thank you so much for always helping us and to put up this webinar for the patient. Yeah, so far really, thank you so much for attending and spending a precious Saturday afternoon with us, and we do hope that everybody stays safe. And if there's any problem, you can always WhatsApp us or message us. We are still open because if let's say you are in pain, we are still here to help you. Okay, this is our webpage also. You can actually visit us. And everybody, thank you and stay safe. Yeah. So, Keith, any questions?
No, I think all good. So we can leave this last page up for other people to take down the details if needed. Otherwise, we will stop this call at 3 p.m. then. And feel free, anyone that just want to ask more questions, feel free to type them into this chat function. All right, take care, everyone.
Thank you.
Thank you. Thank you.
Thank you.
Okay, so Dr. Henry, we will we'll collate all the questions. Actually, you can turn on the chat. Or okay, you leave this presentation on first. Later, the chat will still be safe, and we will just collate all the questions and send it to you. Like if you can and have time, help us answer them.
No problem.
For your professional opinion.
Sure.
Thank you.